important topic about the how to keep your legs healthy. This is my alma mater where I work. So, question arises, what are the enemies of your legs? पैरों के दुश्मन कौन कौन से हैं? एक तो आपका लाइफ स्टाइल है, डेली रूटीन है, और सिगरेट पीते हैं लोग, और ओबेसिटी है, वेट बढ़ा लेते हैं, शुगर है, हार्ट प्रॉब्लम है, फाइलेरिया है, प्रेगनेंसी है. प्रेगनेंसी तो ऐसा कोई प्रॉब्लम नहीं है, प्रेगनेंसी तो टाइम बाउंड वो है, तो उसका कोई प्रॉब्लम नहीं है. सो एक के बाद एक मैं डिस्कस करूँगा. लाइफ स्टाइल क्या प्रॉब्लम है. लाइफ स्टाइल में क्या है कि लोग पीपल डोंट वॉक डेली, and absence of daily leg exercise like ankle exercise, and sitting long hours in workplaces, office job requiring prolonged standing, lethargy and sedentary lifestyle by nature or by due to affluence or due to old age. So lifestyle, domestic front, what happens in the home, that people are eating more, activity is very less, and if they want to go to vegetable market, they use bike, scooters and cars. So long hours of sitting in front of television sets and computers. You would have observed old ladies who they are sitting in front of television for long hours. Then office jobs, prolonged sitting in front of computer, multinational companies or hospitals also, prolonged standing and reception jobs also, use of elevators in the offices. We generally use elevators even going to the first floor also, and work hard and party harder. That is the motto. That is also creating problems. In hospital settings, what happens? Prolonged surgeries of the patient, surgeon is also involved in that, and nature of surgery, total hip or total knee replacement. In ICU patients also, no proper and effective compliance of active guidelines for prevention of DVT, and in OT and ICU. So how does your lifestyle harm your leg? Because normal functioning valve, which carry the blood, venous blood, rather than say without oxygen blood, less oxygen blood, deoxygenated blood, that is has to go back to the heart. But if the valve is damaged, then it goes up and goes down. So it's a two-way system applies. That leads to problem. That is the first problem, is chronic venous insufficiency. That is called chronic or valvular incompetence. Second, if you see this leg, then this is the early warning signal to change your lifestyle. So this is, if you observe your thigh or leg having this kind of veins, so if you see warning signal, so you have to be alert, change your lifestyle. Second, if you still don't follow, change your lifestyle, then you will see this kind of leg. I think you would have noticed in legs of your relatives or family members. So if you still don't follow the change, and you will drastically don't bring about the change, you will follow this, okay? And if still you don't change your lifestyle, then the final stage will be like this. See these pictures, these are the real pictures, not downloaded from the internet. So I think these were our patients, okay? And secondly, how lifestyle harms your leg, then it becomes a collection of blood clots in the leg veins. So you will notice that sudden swelling. See, this is the sudden swelling. So that is due to collection of blood clots in the leg veins. So when clot persists and it damages the wall, venous wall, then the instead of one-way traffic, the two-way mechanism starts. Blood goes in a standing position during walking or exercise. The muscle pump pushes the blood proximally, distally out through the perforators into the superficial system. So that will lead to increased venous and capillary pressures. So this condition is very harmful. So what will be the fallout? That edema, that is the swelling, then the stasis pigmentation, the color change in the skin of the lower legs, as I have shown in the previous slides, because of subcutaneous hemorrhage near the vicinity of the perforating veins, and the branches, venules, they get ruptured. Then leads to subcutaneous fibrosis, cutaneous atrophy, lymphatic obstruction, and stasis ulcer. That is difficult to manage. As I have shown in the previous slides, that you have seen how bad conditions are the leg ulcers. People come with the non-healing ulcer. They have been treating outside for the 2-3 years, but ulcer doesn't heal. Second complication of that leg problem, ulcer, I have already, this kind of ulcer, this young man from the Jaipur has been suffering from the leg ulcer, non-healing leg ulcer. Lot of antibiotics were tried, but reason was something else. That is because of the chronic venous obstruction. That's why ulcer was not getting healed. And second complication, that you see the clots, they shift upwards to they choke the pulmonary arteries. So that is a very dangerous situation. Now, the people in India, they are very addicted to smoking and tobacco chewing. They use cigarette, bidi, hookah, khaini, chaini, zarda pan masala, and all these things. So these are the how this affects the legs. See, this is the gangrenous toe. This is the shape of the mild change. Now, this is the gangrene developed. And this is the bypass. The photograph of the bypass is being done, arterial bypass. What smoking and this tobacco leads to blockade of the blood pipes. Blood pipes, I'm just for the common persons using this term. The blockade of the blood pipes of legs due to smoking. You can see the blockade in the leg veins, leg arteries. See, because of it, nicotine narrows down the arteries. Then the next is if you raise your weight, increase your weight, and you become overweight, then you can see this picture, and even if a small prick will lead to flare of this infection, cellulitis. You see, because of the lot of fat inside the leg and lot of venous congestion. So both mix, and whenever there is a cut or any bite by any insect, it will lead to cellulitis. See this. The very common feature in old person who is obese and overweight. You must have seen in the family members or among relatives. See, if you are a diabetic, I brought this slide just to explain it. So in diabetes, every foot undergoes structural anatomical changes. See, this becomes curvature because of the lumbrical muscles, paralysis, and loss of sensitivity, and the toes, they become claw-like. Okay? So this is the configuration. So pressure areas are this. So they are this area is very susceptible to ulcer formation. Like you see, This is the pressure areas. See, see this. This is an amputated leg. So these are the real pictures. You can see the persons are suffering from this. Then blockade of blood pipes of thigh. Because of the diabetes, you see these blockade. They start because of deposition of calcium and cholesterol. Heart disease and kidney disease, they also affects your leg health, because especially in severe constrictive pericarditis, severe tricuspid regurgitation, severe pulmonary hypertension, heart failure, and severe renal function impairment. So all these conditions lead to swelling in leg and feet due to stagnation of blood. Any abrasion, any minor injury will lead to severe cellulitis and non-healing ulcer. So what to do? Do daily walk for 1 to 2 hours and controlled weight are the two fundamental factors. Without implementation of these, it is almost impossible to keep your legs and feet healthy. Then exposure to sunlight to 2 to 3 hours daily is very essential. In summers, you can get exposure to sunlight in the morning from 6 a.m. to 8 a.m. and in the evening 5 p.m. to 6 p.m. Then avoid prolonged sitting, that is very important, and prolonged standing for more than 1 hour. Take a short break after every 1 hour. Avoid, if possible, joining a profession that requires long hours of continuous sitting or standing. You should avoid that profession. If time permits, do cycling and swimming. Then what to follow? Stop smoking altogether. Whosoever smokes, that is very bad for your leg health. Avoid using tobacco-based mixtures, jarda, pan masala, jafrani patti, gul, that is used in Bihar as a toothpaste. As use of these products will eventually cause amputation or loss of feet in near future. If you are a diabetic, first you should control your sugar level at any cost. Secondly, keep your feet clean, dry, and avoid any injury to the feet. Always clean. After bath, remove the moisture between the toes and clean it with the surgical spirit, okay, daily after bath. And never use chappals, sandals, slippers. Use soft and well-cushioned shoes, and never wear shoes without socks. That is very important. Never walk barefooted, neither inside or nor outside the house. Because diabetic patients, they don't follow these guidelines. That's why they suffer a lot. Silicone insole inside the shoes. You can always, every diabetic person should use this. And these are the Crocs shoes they can use inside the house. Outside, they can use sports shoes or other diabetic specialized shoes are there. Then filaria is also is creating problem for the leg health. So never allow breeding of mosquitoes in nearby surroundings. Use anti-mosquito spray and mosquito nets in the night. This is the only way to avoid attacks of filariasis. See, this is the filarial leg, and you see lymphatic block. Next is the pregnancy, because if you because this is pregnancy is inevitable, and so this is a shot for 9 months. So pregnant ladies should take precaution. They are sitting, if they sit for long hours or stand a lot in a workplace, then it is detrimental to the unborn child, possibility of impaired fetal circulation and premature delivery. Why DVT in pregnancy? Because of the pre-thrombotic state in pregnancy is achieved, and the variety of factors like 2, 2nd, 6th, 8th, and 10th are increased during pregnancy, and protein S level is also decreased. And that is during pregnancy, increase in blood volume a total of 20%. So in a standing position, that leads to increased accumulation in the legs, a factor for major problem in pregnancy. So sudden appearance during pregnancy, if sudden appearance of a leg swelling, it will herald the beginning of deposition of blood clots inside the deep veins of thigh and legs. A pregnant lady should give top priority for prevention of any problem in the leg, because if problem is there, if medicine is prescribed, that may be detrimental to the fetus, or if surgery is done, this is also not a problem, because then you have to discontinue the pregnancy. So final word, if you notice in your leg either black discoloration or patches or ulcer or prominent blue colored veins or swelling or redness, please do not sit idle and promptly consult an experienced vascular surgeon. Your careless attitude may cost your leg eventually. Always go to a hospital where facilities for special investigations like Doppler study, angiography, venography, lymphangiography, and ventilation perfusion scan are available. Never forget fundamental points that for foot care as mentioned above while being treated. Okay? Thank you.
Thank you, Dr. Pandey, for giving a very nice talk about limbs are very important, lower limbs. Those who suffer, they know. Those who do not suffer, they don't know. But I think the elderly population after age of 65, 70, diabetic population, they are more sufferers, and peripheral vascular disease is increasing day by day. May I request Dr. Thank you, Dr. Pandey, please have a seat here, and we'll give the memento after the session. Dr. Mukesh Goel, the last talk about on this session before we break for the lunch. We'll have a little limited lunch. We are a little short of time. We're running late by almost 20 minutes.